Welcome, lovely people. The health of an individual matters a lot. So also the health of an individual also determines how the neighbor relates with such an individual. This is also applicable to the health of a country. The health of a country is very important. So also the health of a country could affect the health of the neighboring country. That takes us to what happened in the year 2020 during the COVID-19 pandemic. It all started from a country and it escalated, spread around the world. And this has taught us a very important lesson to always check on the health of our neighboring country. It is in this ideology that today we shall be traveling to Japan to see what is happening in Japan. My people, welcome to Japan. So in Japan, let's look at what news they're talking about. First, have you seen this news? This news is published by Scientific American, which is a division of the Springer Nature America Incorporation. Springer Nature is owned by Springer, Macmillan, and Nature, which is highly respected and most popular scientific publisher in the world. It says, flu cases surge early in Japan, sparkling global health concern. This news was published in October 17, 2025. Another news outlet, which is the Economic Times News in India, on October 11, 2025, published Japan flu epidemic. Over 4,000 hospitalized, more than 100 schools shut as experts warn virus may be mutating. Here is what we know so far. Another news outlet, which is the Center for Infectious Disease Research and Policy at University of Minnesota, says Japan sees early flu activity with school closures. This news was published in October 14, 2025. Finally, we look at another news outlet, which is My News in China. This was published in October 8, 2025. It reads, Japan's flu season hit 5 weeks earlier amid fear of evolving virus. So today we'll be looking at the 2025 Japan's flu virus outbreak, which is an epidemic within the country. And this has caused for global alarm, right? Not yet a pandemic. However, it has called for a global alarm. Today, we'll be looking at what is happening in Japan as at this month. We'll be looking at what are the causes of the epidemic that Japan is experiencing currently. We'll be analyzing the causes as released by Ministry of Health of Japan. We'll be looking at the countries that are primarily at risk of the virus. And finally, I'll be giving my recommendations for immediate control of this epidemic. Join me in this journey as we explore the health of Japan and the health of the world relatively. My lovely viewers, before I continue, can I tell you to do something? Do this for me. Press the like button. Press it, press it, press it. Press the like button. Press. Press the like button. Yes. Like this video so that it can grow wider and there will be more visibility of such a news like this. All right, let's continue on our session. It was on October 3, 2025 when the Japan's Ministry of Health, Labor and Welfare declared a nationwide influenza epidemic in Japan. It is an influenza, right? Because it is what? It is virus, right? And it is epidemic because it has been confirmed to have spread around Japan with high impact on the country already. And this is one of the reasons why it is of global alarm for every country to be aware of this and to put all necessary measures in place in order to control the spread of this virus. So let's look at what the Japan Ministry of Health have confirmed that have made the ministry to make such announcements or declare such influenza an epidemic. One, the ministry has confirmed that the flu season in Japan started 5 weeks earlier than usual. Two, the Japan ministry confirmed that normally the high cases, which is a spike that is experienced in this month of October 2025, used to be experienced in the ending of November in the previous years. As of October 10, 2025, Japan already has a total of 6,013 cases of influenza virus in the country, and that is for the cases that were reported. Of course, we should expect that some cases will not be reported, right? But maybe few cases will not be reported. Similarly, Japan has created 3,000 designated health institutes for tests. Now, each of these 3,000 designated health institutes has exceeded the official epidemic threshold of 1 case per week, And these haven't gone beyond the threshold or reached the threshold and gone above the threshold cause for concern. It is also observed that there is a rising hospital admissions with high number among children aged 14 years or younger, that is from 0 to 14 years children, and older adults. By older adults, right, that is from 65 years and above. And finally, there are more than 100 schools that have been closed due to this epidemic. And considering all these factors, the Ministry of Health in Japan has decided to call this spread of virus an epidemic. So, what are the suspected causes of this epidemic in Japan? One, there is heavy immigration from Australia to Japan. So says the Ministry of Health, that the heavy inflow of immigrants from Australia to Japan could have been a primary cause or spread of the virus. Two, there is a lack of exposure of the circulating virus, the ongoing virus, right, by many elderly people. People more than 65 years, right, and young children, by young children, 0 to 14 years of age, as a result of the useful non-pharmaceutical intervention used during the COVID-19 pandemic. We shall analyze this further to look at what this means. Third, there is increased international travel after the COVID-19 pandemic, which has allowed for faster cross-border virus transmission, so says the Ministry of Health in Japan. And finally, the climate change from summer to winter has also contributed to the spread of this virus. Let us look at these two reasons. The first two reasons by priority, let's look at it and analyze it. How could these have contributed to this epidemic? Now, according to the Ministry of Health in Japan, the first reason which they have associated to this this epidemic has been the heavy flow, right? That is the heavy flow inflow from Australia to Japan. So let's analyze this. First, this is the map. Here is Japan. Here is Australia. So looking at Japan to Australia, we have this distance, right? That's the distance. So the ministry said, first, the epidemic was likely to be associated with influenza A type with H3N2 subtype. They said the same strain of virus that surged in Australia and in New Zealand. New Zealand is here. This is New Zealand to Japan. Over the previous 2 months, in month of August and in the month of September 2025. All right, so what they mean is that 2 months ago, August and September 2025, there was surge of this virus, influenza A type, in Australia and in New Zealand. And thirdly, they said Malaysia has also experienced early flu season this year. So Malaysia has also experienced that as well too. Right, where is Malaysia? This is Malaysia to Japan. Right. So looking at this immigration status from Countries like Australia, right, particularly Australia as emphasized by the Ministry of Health, to Japan has been number one cause of this influenza. So let's look at what is happening in this country with the statistics from World Health Organization. So this is the statistics of the population of countries around the world, right? And this is from webdometer.info website. So focusing on Japan, this is Japan here, right here. So Japan is the 12th most populated country in the world after India, China, United States, Indonesia, Pakistan, Nigeria, Brazil, Bangladesh, Russia, Ethiopia, Mexico. Next, we have Japan. Japan has over 123 million population, and Japan, with net migration, right, with net migration, Japan has a positive net migration of over 140,000. What does that mean? Net migration means when you remove the emigration from the immigration, so what you have left is called the net migration, right? Immigration talks about people that enter Japan, and immigration means people that left Japan or people that are leaving Japan to other countries. So if you remove the total number of people that are leaving Japan, remove it from total number of people that are entering Japan, so we have 140,579. What this means is that Japan has more people coming into the country than more people going out of the country. Again, this goes in line with what the Minister of Health has said, that the inflow, right, but we will now be narrowing this inflow, right, this immigration down to those 3 countries that have been mentioned by the Ministry of Health. According to the website of World Health Organization, looking at the dashboard, this is the Power BI dashboard link for the statistics on the influenza A and influenza B statistics in different countries, right? So what I have done is I've decided to look at Australia, the statistics of Australia for the past 12 months, and concentrating only on influenza A. There are of 4 types and 1 subtype there, right? So I've excluded influenza B. Now, for Australia, for the past 12 months, right, this is the number of positive cases, right? This is the chart for the number of positive cases that Australia has experienced. And from here, you will see that right from July, Australia has a sudden increase, right? A sudden increase, and there is a spike. The highest number was over 600 positive cases, which was somewhere in the last week in July. After that, this actually reduced. So this goes along with what the Ministry of Health for Japan said, that there has been such a surge of number of influenza cases in Australia. Yes, this can definitely contribute to the epidemic in Japan, considering the fact that we have confirmed that Japan has more immigration than immigration. There is high number of immigration. Let's look at New Zealand now. The statistics for New Zealand, still from the World Health Organization, for the past 12 months, considering only the influenza A virus there. Again, this we could confirm right from July. We could confirm that there is increase in positive number of cases right from somewhere in last week in August 2025, and it increased to this point. Again, the highest we had there was slightly above 30 number of positive cases, and that was experienced where in last week, the last 2 weeks in September 2025. Next, let's look at the statistics of Malaysia. So this is the statistics for Malaysia, right? Again, considering only influenza A, right? So it will be observed that from September, right? You can see from September there is an increase of the number of positive cases, right, of influenza A in Malaysia, and this rose up to the last week of October. That should be second week in October, which was around around 250, right? Around 250. So again, people moving from Malaysia to Japan could have contributed to it, but it is more of people coming from Australia. Why? Because Australia had their early experience, right? They had it from July, August. So the Ministry of Health in Japan is correct to have said Australia had their experience early enough, right? So this justifies for the first cause of this epidemic in Japan. The second reason mentioned by the ministry responsible for this epidemic in Japan is that there is lack of exposure to the circulating virus, which is the influenza A, by many elderly people, right? People of 65 years and above, and young children, that's 0 to 14 years old children. And this is as a result of the useful non-pharmaceutical intervention used during the COVID-19 pandemic. Now, what this means is this. During the pandemic, there were non-pharmaceutical intervention approach like use of face masks, washing of hands, social distancing, shutting down of the schools and public places, among others. Now, this non-pharmaceutical approach really helped, but then it created a challenge. What is that challenge? Is that it didn't expose those people that were majorly inside. It didn't expose their health to influenza A virus. And majority of those people happen to be the elderly people and the young children. And as a result of this, the health of this set of people were not exposed to the influenza A virus, and their health did not build immune against the virus. Consequently, is that in subsequent years, their health will find it difficult to fight this influenza A virus. Is that correct? Let's look at what science say about this. First, we look at the work of Wagatsuma et al. 2022. It is titled, "Was the reduction in seasonal influenza transmission during 2020 attributable to non-pharmaceutical interventions to contain coronavirus disease 2019 COVID-19 in pandemic in Japan?" The summary of the finding says there is strong adherence to non-pharmaceutical interventions in Japan, no doubt, and this was associated with large drop in influenza transmission. That is, there was large drop of number of cases or positive cases in influenza transmission. And this implied a reduced natural exposure across the population. That is, the population is not exposed to influenza A transmission, hence reducing the immune system. Let's look at the second article, the work of Takahashi et al. 2023. The work is titled, "Surveillance of Seasonal Influenza Viruses During the COVID-19 Pandemic in Tokyo, Japan, between 2018 to 2023, a single-center study." The findings of this study says that Japan's influenza cases fell dramatically during COVID-19. The number of positive cases of influenza A fell dramatically, right? And this brings about increased concern about the decreased population immunity for later season. Where is that later? Now, that is after pandemic, post-pandemic, right? So it says there's likely to be a decreased population immunity. So this again supports what the Ministry of Health in Japan has said about the cause of this epidemic, right? So what are the impact of this epidemic on Japan? First, we look at the first two reasons, right? One, hospital beds reach over high percentage occupancy in the wards. So number of admissions has increased in the hospitals for people in Japan, right? So consequently is that the hospital has been overused and further admissions in the hospital will be affected. Two, approximately 125 schools and child care centers within the country have been closed recently. This tripled the number which was experienced this time last year, with hospitals facing increased demand for antiviral treatments and beds. Right. So these two reasons have been released by the Ministry of Health. Now, going further, we expect that these 5 reasons will have also be an experience in the country. One, I expect that there will be worker absenteeism in the country, and this will be at high level. Two, I also expect that pharmacies will run short of antiviral drugs, and face masks and vaccine as well too. Though, as at the time of capturing this report, there was no record of deaths in Japan yet. I also expect that there will be public fear and anxiety in the country, and consequently, this will lead to long queues for the collection of vaccines and antiviral drugs in the country. I also expect that government health expenditure will increase seriously towards reallocating emergency funds for vaccination, antiviral production, and hospital staffing as well too. And all this will have serious impact on the people and the economy of Japan. So, what countries are likely or primarily likely to be affected by this epidemic in Japan, right? And this, we need to look at this very well in order for us to be able to prevent pandemic. So, now, looking at the map, this is Japan right here. Japan has talked about the inflow from Australia. Australia is down there, right? And also, Japan has talked about Malaysia. This is Malaysia here, now forming this triangle. So the first set of people that will be affected, we consider them people within the countries within this triangle. This include the Philippines, Indonesia. These two countries are there within the triangle. Moving further, I also consider those countries that fall within this range as well too. So countries like the North Korea, the South Korea, this country needs to be more careful. China needs to be more careful as well too. We have Bangladesh, we have Taiwan, we have Thailand, we have Vietnam, right? And other countries within this range. These countries need to be more careful, right? I've excluded Russia because I believe due to the ongoing war in Russia, between Russia and Ukraine, will have limited the number of people moving from neighboring countries, right? Neighboring countries from around Russia into Russia. And as a result, I've excluded Russia in this case. So these countries need to pay more attention towards people, the immigration in their country in order not to be affected by this epidemic in Japan. So one of those things that medical experts have talked about this influenza A, which is the cause of the virus spreading in Japan, is that this virus is likely to be mutating, right? Now, what is the implication of this mutating, right? First, let's look at it. We have what we call the influenza A, right? We have influenza A, we have influenza B, we have influenza C, right? And we have influenza D, right? Now, influenza A, B, and C affect human beings, yeah? Affect humans, while influenza D affects majorly animals, right? Now, concentrating on A to C, among influenza A, B, and C, influenza A is known to have the ability to change its gene. Changing its gene is referred to as the mutation. Now, mutation, when the virus changes its gene, what it does is that the signs and symptoms will definitely change. So what we know, those signs and symptoms that are known about such virus will change. Immediately mutation takes place. And consequence of that is that the existing medical intervention that is in place may no longer be effective to control such virus. And that is why it is very important to pay attention to the virus mutating. So let us look at it. What is the implication when this influenza A mutates in Japan? One is that mutation makes the virus to spread more easily from person to person. Number two, mutation helps the virus to evade immune defense. That is, the existing immune defense may no longer be effective to control the virus from previous infections or vaccine, or slightly change its symptoms or severity. Number three, mutation leads to higher case numbers or earlier spread as seen in Japan. Immediately mutation takes place, then the existing medical intervention will no longer be effective, hence making the virus to spread quick and increasing the number of positive cases. So what is the immediate solution that we can do if the virus is mutating? One, there must be early detection of mutation. We need to confirm immediately that this virus is mutating by the scientists, and we need the help of World Health Organization to come into this as a matter of emergency. Number two is we need to update Japan, and World Health Organization needs to update the existing vaccine and medication, in order to address the issue of mutation of influenza A. So finally, let us look at the recommendations which I have for Japan and of course World Health Organization as well too. One, Japan should bring the flu jab forward and distribute it nationwide by setting up pop-up clinics at schools, stations, malls, and other public places as well too. And SMS reminders should be sent to people to go for their jab. Two, Japan should prioritize jabs and antiviral for older adults, 65 years and above, young children 0 to 14 years old, pregnant women, and people with long-term conditions. This set of people or population should have priority. Next, Japan should make classes strictly online. Schools should not be shut down. Schools should be transferred from in-person to online in order to make learning to continue. Next, Japan should make use of fast and simple treatment pathway. What is that pathway? Symptoms. Once an individual has symptoms, go for test immediately. Once you go for test, you should go for antiviral within maximum of 48 hours. And make it, very important, make it cost-free to test during this surge period. Still on my recommendation, there should be temporary masking guidance for crowded places like the transport, clinics, until the surge is reduced significantly. Next, Japan should keep the health workforce safe by opening overflow clinics, extending working hours, and protecting staff with clear sick leave. Next, Japan should have mandatory visible symptom checks among travelers, among immigrants, at airports and seaports, among other places that immigrants are allowed to come in. Finally, Japan should transparently give daily and weekly updates of statistics to build trust with the people. This is very important for Japan to give daily and weekly reports in order to build trust through transparency among the people and in the world. This is very important because from the World Health Organization dashboard, looking at the statistics of Japan for the past 12 months and statistics for influenza A, what I observe is that there is the number of positive cases in Japan for July, August, September, and October is very, very minimal. Look at it. It's very, very minimal. In fact, it is less than 20, for each week in September or October. The Ministry of Health in Japan says that there is an early experience of this flu. But from the statistics we have here, we cannot confirm that. So this seems to confirm to us that there is an underreporting of these statistics in Japan. Or perhaps this has not been updated, but to whatever the case may be, Japan needs to build trust within the country and outside the country with transparency by reporting the number of test cases and positive cases to World Health Organization so that we can all see as it goes. Dear lovely viewers, so this is the situation of the epidemic in Japan. What do you think about this? What do you think the World Health Organization should do about this? What do you think that the government of Japan should do? And what do you think that your government in your own country should do? Put this in the comment section below. Ensure you like this video, right? Share this video and like it. Like it now. Put, thumb up, put it. That is it. That is it. All right, lovely people. That is it for us today. Till I see you in the next video. Ensure you keep yourself happy and safe. See you another time.